Your appendix may be gone, but your body is only beginning the healing process. What really happens after appendix surgery? Right after surgery, your body immediately starts repairing the internal tissues affected during the operation. Pain, weakness, and fatigue are common during the first few days because the body is using energy to heal. The surgical incisions gradually begin closing as new tissue forms beneath the skin. Doctors usually encourage light walking soon after surgery to improve blood circulation and reduce complications. The digestive system may temporarily slow down after surgery, causing bloating or discomfort. Severe pain, fever, vomiting, or redness around the incision could be signs of infection and should never be ignored. Most patients return home within a short time, but full recovery may still take several weeks. With proper rest, hydration, and care, the body gradually adapts and returns to normal activities. Understanding recovery after appendectomy can help reduce fear and support faster healing. Subscribe Medical Officer Pro for more health information.